Schizophrenia is a complex mental disorder that affects a person's thinking, feelings, and behaviors. The symptoms of schizophrenia can vary widely from person to person, and they can be grouped into three categories: positive, negative, and cognitive symptoms. Positive symptoms refer to behaviors that are added to a person's normal behavior. These symptoms can include hallucinations. Hallucinations are sensory perceptions that are not based in reality. The most common type of hallucination in schizophrenia is hearing voices, although hallucinations can also involve seeing, feeling, tasting, or smelling things that are not there. For example, an individual with schizophrenia may hear voices that command them to do things or insult them. These voices can be very distressing and can interfere with daily activities. Delusions are false beliefs that are held despite evidence to the contrary. Common delusions in schizophrenia include believing that one is being persecuted, followed, or monitored by the government, or that one has special powers or abilities. For example, an individual with schizophrenia may believe that they are being targeted by a secret government agency or that they are a famous celebrity. Disordered thinking can cause speech to become difficult to follow, as thoughts may be fragmented or unrelated to one another. This can make it difficult for individuals with schizophrenia to communicate effectively. For example, an individual with schizophrenia may speak in a way that is difficult to understand, jumping from one topic to another or using words in unusual ways. Negative symptoms refer to behaviors that are taken away from a person's normal behavior. These symptoms can include apathy is a lack of emotion or enthusiasm. Individuals with schizophrenia may struggle with basic daily activities, such as showering, dressing, or going to work. For example, an individual with schizophrenia may struggle to find the motivation to complete tasks, even if they are important. Lack of motivation can make it difficult to engage with others or to take care of oneself. Individuals with schizophrenia may have difficulty initiating or sustaining activities, even if they previously enjoyed them. For example, an individual with schizophrenia may stop participating in hobbies or social activities that they used to enjoy. Social withdrawal can lead to isolation and difficulties in relationships. Individuals with schizophrenia may avoid social situations or struggle to connect with others. For example, an individual with schizophrenia may avoid family gatherings or social events with friends. Cognitive symptoms refer to difficulties with thinking, memory, and attention. These symptoms can include difficulty concentrating can make it challenging to complete tasks, follow directions, or engage in conversation. For example, an individual with schizophrenia may have trouble focusing on a task or may become easily distracted. Disorganized thinking can cause speech to become difficult to follow, as thoughts may be fragmented or unrelated to one another. For example, an individual with schizophrenia may struggle to express themselves clearly or may have difficulty organizing their thoughts. Memory problems can make it difficult to remember important information, such as appointments or medications. For example, an individual with schizophrenia may forget important dates or may struggle to remember the steps required to complete a task. Overall, the symptoms of schizophrenia can be complex and can vary widely from person to person. It's important to remember that with proper treatment and support, many individuals with schizophrenia are able to manage their symptoms and lead fulfilling lives.